it's Christina with the Sisyphean Journal. Today is March 26th, and I got a bit of a shock when I was doing more research. You know, if you follow my channel or my blog, that I frequently do more research to see if any more information is available about abortion deaths. And I found some very interesting stuff when I looked for more information on the 1986 death of a 29-year-old woman named Gail. All I had known was what I had abstracted from her death certificate when I was working at Life Dynamics, which is she was 29 years old, 20 weeks pregnant, and underwent a legal abortion, developed sepsis, and died of adult respiratory distress on March 26, leaving behind a husband. I don't know if there were any children because that's not on the death certificate. Well, doing more research to get more information, I found an article. The abortionist was Wyman Garrett. He's the one who 2 years earlier had sent a 14-year-old patient home to die from a massive infection. Garrett had performed Gail's abortion at University Hospital in Newark sometime before March 21st, which is when he was suspended from privileges at the hospital. And he was suspended for botching 4 abortions, including the one that had killed the 14-year-old girl. He also left the fetal head in a patient's uterus, one in which he caused massive uterine lacerations, and another one where he performed an abortion at 32 weeks, which was way beyond the hospital's cutoff point. Now, those weren't the only cases he was in trouble for. If you're on Rumble, you can follow the link to the companion post, and I have a metric buttload of stuff about this character, Wyman Garrett. And he pleaded no contest with the medical board when they were looking at a total of 31 instances of gross malpractice. Now, Gail died in Overlook Hospital in Summit, New Jersey, which was not the hospital where the abortion was performed. So it's unclear if she developed the infection and they transferred her to the other hospital, thinking she'd get better care there. It's more likely that she'd been discharged from University Hospital and went to Overlook because it was closer to her home. So her death remains equally tragic, but I had originally thought that the medical board slapping Garrett down had prevented any further deaths, and unfortunately I was wrong. While all of this was dragging out, he did manage to kill another patient. So his excuse for botching all these abortions was burnout. He had been doing 12 to 14 second trimester abortions daily at University Hospital. That's roughly one abortion every 30 to 35 minutes if we're assuming an 8-hour workday with an hour for lunch and no bathroom breaks. The procedure itself typically takes 15 to 30 minutes, according to UCLA Health, and that's just the procedure. That's once you start poking around. That's not washing your hands. That's not talking to the patient before you start the procedure. That's just the actual reaching in with your forceps and pulling the baby apart. So, and he was being paid $250 to $300 by the hospital for each abortion, meaning his daily income in 1986, daily, could range from $3,000 to $4,200, which is $8,700 to a little over $12,000 if we adjust for inflation. So maybe he was burnt out because he was making money hand over fist, pulling second trimester babies apart alive with sofa forceps. So, unfortunately, he was very much admired in his locality because of his community activities, but people still praised him for being a good doctor. Maybe he was fine as long as he wasn't doing one of these rushed through second trimester abortions on you. But again, if you're watching this on Rumble instead of on YouTube, you can follow the link below to the accompanying documents. But this guy was a piece of work.